Bismillahirrahmanirrahim. Today we will have case quiz number 64. Case data: 28 years old female with no medical or surgical history of clinical importance, presented with worsening acute right hip pain for several days. Acute right hip pain for several days. Patient symptoms started at late night after a day of heavy work, but with no history of trauma. The patient was urgently referred to the orthopedic clinic because of concern of a septic right hip. On examination, the patient sat with the right hip in a flexed position. She reported pain with minimal passive motion of the right hip and didn't tolerate hip flexion beyond 70 degrees. She had pain with minimal internal and external rotation of the right hip. No erythema, worms, or swelling around the right hip. Investigations showed white BCs within normal, CRB increased somewhat 4 milligram per deciliter, and the normal is less than 1 milligram. ESR somewhat elevated but not shooting. Uric acid within normal 3.2 milligram per deciliter, and the normal is up to 7. Lipid profile was within normal. ANA negative. Rheumatoid factor negative. TSH level within normal. Radiographs of the pelvis and the right hip were unremarkable for any fractures or dislocations. Non-contrast MRI showed a large right hip effusion. A hip aspiration sample yielded cloudy yellow fluid, which was sent for gram staining, cell count culture, and crystal analysis. The cell count of the hip aspiration was notable for white BCs of 5.9 thousand per milliliter with 89% neutrophils. The gram stain aerobic, anaerobic, fungal, and tuberculous culture were all negative, and the blood culture also was negative. So, what is the diagnosis? The answer is this disease is common, but common in males and in older age. It is very rare in young females. It is gout. Yes, just gout. So, what about gout in young female? The result of the crystal analysis for the hip aspirate in this patient show needle-shaped negatively birefringent crystals consistent with MSU crystals. So the diagnosis of gout was established. Although it is very rare to see gout cases in young female with no predisposing factors such as psoriasis, so gout in young female is very rare but can be seen. Gout is a common cause of acute monoarthritis, which most frequent involved the first MTB, the ankle, and the knee. The differential diagnoses include calcium pyrophosphate deposition disease, CPPD, or pseudogout, and septic arthritis. Gout is commonly diagnosed on the basis of clinical presentation alone, although the gold standard is via synovial fluid aspiration from the affected joint and identification of needle-shaped, strongly negatively birefringent MSU crystals under polarized light microscope. In contrast, crystals that are found in CPPD are rhomboid-shaped and positively birefringent. In septic arthritis, no crystals are seen, and the fluid analysis will show a markedly elevated white BCs count may reach up to 100,000 per milliliter. Risk factors for gout include excessive consumption of purine-rich food, alcoholic drinks, metabolic syndrome, hypertension, positive family history of gout, osteoarthritis, and chronic renal diseases. The prevalence of gout is 7 to 9 times higher in men than in women, with an average age of 53 years. So it is not the common age and not the common sex for young female. Premenopausal women are protected against gout, usually from uricosuric effect of female sex hormone. Early onset gout has been reported in a number of disorders that results in elevated level of serum urate, including Liskini-Hand syndrome, Kelly-Sigmiller syndrome, glycogen storage disease, and familial juvenile hyperuricemic nephropathy. Matsu et al. Also found that dysfunction of ABCG2 gene is a major cause of early onset before 30 years of age gout, especially in females. The worldwide prevalence of gout has increased as the rate of obesity has increased because of a combination of poor dietary habits and lack of exercise. While gout most commonly affects the peripheral joints, there have been an increasing number of cases or case reports of unusual clinical presentation of gout, likely due to an increased prevalence of gout and the rising use of advancement of various imaging modalities. Gout involving the hip is rare, and there are few case reports of this. Barhami et al. Reported a case of 46-year-old man with a history of sickle cell trait and hypertension. Daboyki et al. Reported a case of an obese 36-year-old man with hip gout. Hoyt et al. Reported a case in 54-year-old man with chronic alcohol use and history of gout in the knee, the feet, and the elbow. Other studies have reported gout involving the spine, the sacroiliac joint, and the greater trochanteric bursa, as well as various organs such as pancreas and the heart. To our knowledge, the current case study is the youngest reported case of gout isolated to the hip, and also the only one with no known risk factors or family history of gout, and the only case of young female with hip gout. The initial goal of treatment is the symptomatic relief of pain and inflammation. Medications for managing the acute gout attacks include colchicine, non-steroidal anti-inflammatory drugs, and steroids. The choice of agent and the duration of therapy depend on the patient and the presence of any comorbidities. During the asymptomatic period, serum urate lowering drugs are an option to prevent acute flares and the development of chronic tophi. Urate lowering drugs include xanthine oxidase inhibitors, uricosuric agents, and uricase agents. The indications for using urate lowering drugs include either 2 or more attacks per year or the start of chronic gouty arthritis, which means no period of rest between the attacks. Wang et al. Found that patients with gouty knee arthritis who underwent arthroscopic debridement in combination with oral medication therapy had greater short-term pain relief and improvement in a range of motion compared with patients who received oral medications alone. However, this was not significant difference between those who underwent surgical intervention and those with medication only, so surgery has not a very major role here in the treatment of gout. Diet, which means reducing the intake of alcohol, sugar, and purine-rich foods, and lifestyle changes such as weight loss and increased activity are also key to prevent and manage the cases of gout. The key messages here are: gout is common cause of joint pain in older individuals. However, It is very rare in younger females, but this case report shows that gout should be included in the differential diagnosis when a patient presents with acute monoarthritis regardless of age and regardless of sex, of course after the exclusion of infections. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 65. Wassalamu alaikum wa rahmatullahi wa barakatuh.